Merci beaucoup, Linda. C'est un grand plaisir d'être ici avec vous et vous tous. Et merci beaucoup, Linda, aussi pour tout votre travail, mais pas juste avec le comité pour l'assurance médicaments, mais pour tout votre travail généralement. Et c'est un temps vraiment important, essentiel pour notre système de santé. Un temps délicat, un temps difficile, mais un temps pour une transformation. And I know for folks working in the health system that it has been long, hard years, that there were deep problems in our health system before COVID. And then in an act of God, we were faced with COVID, which was devastating and a trauma, I think, for everybody, but for people working in health, it was all the more profoundly so. And I think we all hoped that as you carried that tremendous weight and did such incredible work, Canada had one of the best COVID responses in the world, and it's in almost whole part because of the remarkable people that we have in our health system, that there would be a break, that there would be a reprieve. And that's the moment at which I became a health minister. It's about a year and a half ago. And Linda, I talk a lot about Robin, because one of the most powerful moments for me when I first became health minister was in Prince Edward Island and going and meeting with nurses who were working in rural Prince Edward Island. And Robin said she can't take a day off because if she's seen getting groceries, people are going to be angry at her because she's the only person providing care for that entire community. And she was at her wit's end in tears and saying, look, I can take just about anything, but I can't take the idea that it's going to get any worse. And she was so reasonable in what she asked that it stayed deep within my heart over the entirety of this journey. Because I can tell you, taking on something like this, that I attack myself as much as others attack me. I want to see progress, and I want to see transformation, and I want to see it happen as fast as it can possibly be made. And there's nothing harder than looking into the face of somebody who's giving every inch of their being to provide care and to do better, and to see them exhausted and to see them in a place of despair. So every week, every day, I and the folks that I work with, in collaboration with anybody who'd work with us in the Commons or elsewhere, have been attempting to make progress. And in a meta-narrative, talk about the possible. Because as much as we talk about the crisis that exists in our health system, I think we also have to take a look about what's extraordinary about our health system. And we have to do those two things simultaneously, because there are people who are saying, just give up. Allow privatization. You're fighting a battle you can't win. And we can't allow that to happen. One of the great opportunities of the moment that we're in is we're talking with enormous patriotism about our country, is it is our health system that comes to people first, that talk about the incredible benefit that it has. And why is that? Well, because just as I'm devastated when I talk to somebody who isn't getting the support that they need, I am lifted up mountaintops when I talk to people who do get the support that I need. I was in BC Children's Hospital, and I met a doctor who works with cancer patients' kids. She said when she started 30 years ago, the survival rate was 30%. That survival rate is 90% today for kids walking in that door. And those families, they don't pay a cent. Now, I had an opportunity as well, and I'm just going to grab their names because, so it was Katie and Andrew, and I met them at Ronald McDonald House, and their kid got diagnosed with a rare disease. And they had all of that support, and they talked about a sibling, Andrew talked about a sibling near Boston, where their family got wiped out financially in a similar situation. So what is the progress that we've been making? Because there are new stories being added. And let's talk about dental care. When I have the opportunity to go around this country to meet, in some cases, people 30 or 40 years, the same set of dentures in their mouth, getting an opportunity to have teeth in their mouth a smile that they're proud of, setting up family photographs, talking to me about how it's changing their sense of dignity and sense of self-worth. The fact that I remember Dr. Redmond meeting him in Gander. Just in the first 3 months, his clinic finding 3 cases of oral cancer that were there. Imagine what would have happened. Those are people on this new dental care plan, 1.5 million who've received service. And it's been totally transformational. And that's the health system that we must have, is one that's focused on prevention and wellness, not waiting for people to get sick. And that means, yes, we have to support those working in the health system with appropriate wages, with work conditions that make people want to go into the profession and not run away. Now, we've been able to do a lot of really important things on signing deals with drugs for rare diseases and personal support workers. And we've been able to, in the interpretation letter that I recently issued, I think do something really important to talk about making sure that all health professionals, whether it's nurses or nurse practitioners or pharmacists or midwives, can work at top of scope. We're doing incredibly important work on digital transformation. You know, it makes absolutely no sense that we're still using fax machines, that we have so much of our health system burdened with administration that doesn't need to be there, that we have a health system that can't connect. That's why Bill C-72 is so important. That's why over a year ago in Charlottetown with health ministers signing the digital charter was so important. And that's why it's essential that we transform and have an interoperable data system. Europe already has it. They're going to run circles against us. When we have things like AI that can deploy incredible solutions into our health system, if we don't have an interconnected health data system, then we're nowhere. And we're having very good conversations with provinces about that. Just came back from Halifax. And then there's a couple of areas where I'm going to finally have some good news. One of them is on pharmacare. And it's frustrating to me that it looks like we're not going to have the full term of this Parliament to get done some of the things that we could get done. But I can tell you that we're very close to signing the very first pharmacare deals in this country. That is so essential, because when we're talking about contraceptives, we have to be in a world where we sign agreements in every province and every territory. Not just because those contraceptives are so fundamental to people's health, but because it is a broadcast of values in this country, that a woman can have autonomy over her body. And how can you have autonomy over your body if you don't have access to contraceptives? And to me, diabetes, and people sometimes say, why are you starting with contraceptives and diabetes? I think I just made it evident in those statements why contraceptives. But diabetes, because it is a precursor to so many other illnesses. You know, I was head of heart and stroke. You know, the majority of so many stroke cases, cardiovascular cases, doesn't matter the illness, the chronic disease you look at it, diabetes is that precursor. And we do a horrible job managing it. And how frustrated are our health workers seeing patients walk in who didn't have the money for their diabetes medication with deteriorating circumstances that didn't need to happen. We don't just do this because it is socially just, we do it because it is fiscally insane to do anything else. And yes, we have to wake up in a country where every person everywhere has access to the medication they need. And people rightly look me in the eye and say, you're not getting it done. And I agree. But the only way we've ever done great things is one step at a time. And when you're looking at leaders in Nunavut who are talking about a tuberculosis outbreak, talking about incremental change doesn't sound very good, I know. But I also know that it's the only way that we get there. And that my commitment to you, as long as I hold this position or as long as I'm here, I will push with everything I can to get to the world we know we must get to. A system that prevents illness rather than treats people once they're sick. A system that is in communities, lifting people up rather than waiting for them to be rolled into a hospital room. A system that is digital rather than analog. And a system that always, not just in the darkest moments, but in all moments, celebrates the extraordinary Canadians who serve us as healthcare workers. And I would say this in closing. Let us remember the progress we've made while we face the crisis that we're in. You know, we've signed these agreements now, $200 billion, and for the first time we have common indicators across our health system so that we're going to be able to hold ourselves to account in data and not in anecdote on how we're doing. But Canada has 1 year longer than France and Italy that we live in health span. 2 years longer than the United Kingdom. 6 years longer than the United States. Imagine that. We have a huge Canadian advantage. Let's not throw it away, let's advance it. Merci beaucoup.
We're playing dancing chairs. Bonjour, merci beaucoup, Monsieur le ministre. J'aimerais vous introduire Frédérique Chabot, elle est la directrice générale d'Action Canada pour les droits en matière de santé et de sexualité. Avant de rejoindre Action Canada, Fred a travaillé au comité du SIDA d'Ottawa en tant que coordinateur du développement communautaire des femmes et auparavant en tant que travailleuse de rue. Elle ouvrira la discussion avec la ministre et par la suite, nous aurons quelques minutes pour des questions du public. Fred.
Thank you. Nice to see everyone. Just like you, I've spent a lot of time with you in this last year, so I wonder if we're at the point where I can call you Minister Mark.
You call me Mark.
Great. And also, I coordinated our issues.
I like it. Yeah, I like it.
Yeah. So as the Planned Parenthood Federation of Canada, our team, who's here today, has spent a lot of time engaging partners across the country, so sexual health centers, advocates, healthcare providers, medical associations, to galvanize support for the Pharmacare Act, and in the context of C-64, more specifically on the impact of free contraception on people, on families, and on communities. And so we've been talking to a lot of people, and this is happening in the context of everyone heading to the polls very soon. And so we're hearing a lot of worries around the ability to put food on the table, pay rent, pay mortgage, find housing, have good jobs, keep good jobs. And as this worry has really risen in the last many years, there's a lot of politicians that are talking a good game, and when they tap into that fear. The only thing is that we know that for some of them, where they imagine that money going is in the pockets of shareholders and in the pockets of their friends in the C-suites of organizations or companies that benefit from a crumbling healthcare systems because they can make us pay for that IUD or that ultrasound or other medical services that we need. So despite the fact that when we are talking about policies like Pharmacare, which are investment that return right to us in food on our table because we do not have to pay for medical services, we do not have to pay for that MRI, or we do not have to pay for the contraceptions that we need, we are not seeing these conversations really take up space in the affordability conversation. So here's my question. That was a long setup, but here's my question. So as an elected official who played a key role in passing the Pharmacare Act and is now working with provinces to implement it, what challenges do you face in developing societal infrastructures where the benefits may take longer to materialize than a single electoral cycle? And I have a second part, but I'll let you.
Wow, yeah. So that's a big question. It's almost I mean, so the first thing I think is that I think it's a lot less nefarious than people think. I think the reason that things don't happen is largely because the very last point you made is the cyclical nature of our politics. And the need to have like the ribbon to cut on a bridge, or like look at this building that's been created. When you're talking about something like health transformation, you're talking about a 20-year journey to total transformation, right? It's going to take that kind of sustained effort to do it. And what's going to happen at that moment in time is we're going to wake up in a society where people are not sick. And there's much less crime, and people are not in prisons, and we're spending a lot less money. And no one's going to get any credit. No one is going to know that it happened. It's like the slow reverse boiling of a frog. So how do you get people excited in the invisible, right? How do you get somebody, because when I knock on a door, people are rightfully caught in the crisis of that moment. And so politics responds to the crisis of that moment, even if the solution that's being advocated really isn't the best solution for what you need to do overall. And I think there is, unfortunately, we tend to be less, when we're all in crisis, we tend to think about, okay, what's my individual circumstance and how do I survive this? And we're listening to voices of how we survive this. But what we know historically is that when we do not take a sociotropic view and really ask questions about how we make sure how everybody is doing, how are our most vulnerable doing, when we don't ask those questions, we create larger and larger disparities, more and more anguish, more and more pain, and then civil unrest. And people are going to, excuse me. So how do you respond to that? Well, I think what I've been saying is I'm kind of talking about lighthouses, and it's part of like why we've never gotten anywhere on pharmacare before, and partially because we're locked in a debate about doing it all or not doing it at any of it. So by doing a part of it, building evaluation, like British Columbia on contraceptives, in its first year saved more money than it cost for the program. They saved $26 million, it cost them $25 million to do it. So when we can put these things out in the world and build evaluation around it, then we can talk in science and data and evidence. One of the reasons we fought so hard in these bilateral agreements, not to just give money to provinces, but to have common indicators across the system so people can see certain provinces in data are doing better than other provinces, and then ask the question, why are they doing better? And hopefully reward it. And then I think, you know, when I'm talking, I try to do two things. Paint a narrative at the highest level of where I think we can go and why we should do it, be honest about what isn't working, but then give you direct data points of what are we doing right now to move towards that transformation. Because I think if we can lock in a line of progress, going back to Robin, if I can, because I picture Robin in this, if I can go to her, you know, I picture her saying, what did you do this week, right? How are we moving forward in that journey?
Did Elon Musk ask you that question too?
Look, I'll be really straight about this. There are really two narratives that are going on at the same time. One is, you know, grab your pearls, grab your things, and, you know, take whatever you got, you're on your own, good luck to you, right? And too bad, you know, I don't want to hear people suffering, be quiet. It's the you know, basically, might is right, whoever has money and makes the decisions. Here's the problem with that world. We've tried it, and it fails disastrously every single time. Because when you create a world of winners and losers, losers don't stay losers. They're not going to sit around suffering and in pain while somebody else flying around the world, you know, with every possible amenity and joy that they could have. Who's going to accept that? So what ends up happening is losers become winners, winners become losers, and it undulates more and more wildly until you have incredible instability. When do we learn as a planet? Right? Just like, you know, many people in the room are parents, right? You're only as happy as your unhappiest kid, right? When do we learn as a country we're only as happy as our most vulnerable people? And that you can try to shut your eyes to it, you can shove it in closets and pretend it's not there, but that pain will radiate out and cause immeasurable problems for everybody. So it is a deeply selfish, not altruistic act to care about the most vulnerable.
You see that passion that he has for healthcare. It has to be infectious. We have about 5 minutes, so I had to cut poor Fred. She can send him her next question. Any questions from the group? Okay, where's my floating mics? I have this gentleman right here. He was the first. Run.
So
Okay, he's a smart man. He said we'll take 3 at once and then they'll respond. So, and then the next one, this gentleman, and you, I should know your name, Kirsten.
I'm Fred Dugan. I'm president of OFER, the Ontario Federation of union retirees. Mark, I hear your speech. You're right on the issues. I mean, listen, I got a lot of history. I'm an old man, so I've lived under the Tory government lots of times. When PSI and OHIP were amalgamated in 1970, I had a child come into the world who had a medical problem. And for 5 years, it cost me $5,000 for the co-payments, $1,000 each year. So I know all about the conservative system. Joe Clark was the prime minister then. And every time that I've been in the workplace or I've been as a worker, the workplace has always got affected by the conservative government. I worked in a foundry. For every 5 years I got an extra year on my pension credits. Clement and Brian Mulroney took it away from me in 1990. Okay? They took my cost of living as an auto worker away in 2010. A guy by the name of Clement. Incidentally, when he got into trouble, I sent the puke a letter. And I said, too bad you're in so much trouble. Here's an ankle and go for a swim. But anyhow, regardless of that, here's what's happening. And understand this. We're in a position where we're going to have another Tory government if we don't do something. That plan that you talk about with the teeth, I have people I have coffee with every night that have used that plan. And the same thing, you hadn't had teeth for 10 years or 15 years. Dentures that you're talking about. But they say to me, they can't understand this. The NDP government and the Liberals 3 years ago developed a coalition. And in a whole period of time, the NDP and the Tories kicked the living supreme shit out of Trudeau in all that time. And what they say to me is, if you build a coalition and you're going along and you keep drilling holes in the same boat that you're riding in, it doesn't make sense. And that's what the NDP did for this whole 3 years, is the way they look at it. And a lot of these guys support the NDP because they got a new set of teeth in their mouth because of you guys. But at the same time, that's the problem, how it's perceived. Not by us ex-politicians and all the rest of it, by the person on the floor of the House. And that's the problem I see. And I think the best thing for you guys to do right now, if I was in your shoes as the NDP government, I'd extend this government for at least another 6 months if I could.
Okay, my friend. Yeah, you see, there's no question there. There's just a great, passionate speech on we have to work harder for health care. So we'll take a question, and then we have to let the minister.
Thank you very much, and thank you for coming, Minister Holland. Appreciate it. I'm a healthcare worker from Nova Scotia. I've been in healthcare for 32 years. And you talked early on in your speech about the stressors that people are feeling in these days. One thing that oftentimes is ignored in healthcare is the relationship between mental health and physical health. This country has a crisis in mental health. We've seen unprecedented levels of intimate partner violence and domestic violence. And I'm wondering what commitments the federal government has in terms of mental health, and how do we hold provinces accountable for outcomes in mental health? Thank you.
Great. We're cutting it off there.
Yeah, okay.
Great question to finish off, though. One of your topics.
Yeah, well, let me go to Fred first, because just really quickly, because I know there wasn't a question there, but there's a lot of frustration. You notice I really try to talk about the art of the possible and kind of what we can do. And I think that the challenge that we have is that when I speak in political terms, because I have political opinions, no question about it, right? I'm a political actor, but this will be my 8th federal election. I've run on a lot of them. And my thing is that, I left Heart and Stroke, because remember, I made a decision to come back. And when I was at Heart and Stroke, one of the things I advocated for health charities is to speak with one voice so that we had one common vision of where we could go. And I am really seeing my work now as an extension of that, right? And I'm willing to work with anybody. Like obviously we did a lot of work with Jagmeet. Uzoma, who you're going to hear from later, Uzoma is a superstar. Like, they are just an incredible individual. I love working with them. So I'm willing to work with anybody. And I think it's important to understand that politics is just about consensus, right, Fred? So people love healthcare in this country, but we focus on the things that we disagree with, and we pick fights with one another, and then we don't make progress. So I think we all have to speak in one voice. And I'll tell you, I'm in for this battle, health minister or citizen or whatever I'm going to be. I'm in for this battle with you every step of the way, because we have to keep pushing and we can't stop, because we know what we need to do. Then specifically to your question on mental health, I've spoken very directly about my own challenges with my mental health. I try to express to people that I think we all suffer. In fact, I don't know, we tend to talk about like this moment I had, right? Like, I could talk about that. I've talked publicly, this moment I had that was so tough. Like, I don't know how you could be a human being in this world right now and not be having a mental health challenge, right? Like, if you're telling me you got no mental health challenges, that worries me, right? Like, so, like, I'm worried a lot. I'm worried about the world. I'm worried about our country. I'm worried about healthcare. I'm worried about my family. I'm worried, I have a lot of anxiety right now, and it's very hard to stay on the right side of that ledger, even as somebody who has a lot of resources. And there's a ton of people who don't. So what are we doing? We have things like the Youth Mental Health Fund and building community capacity to try to create better community supports to lift people up. And we have to do much more of that. But, like, we need a Me Too moment for assholes, right? Like, I don't care who you are, you're walking through your day, all of us are holding on to way more than anybody understands. Everybody's holding up all kinds of people and just trying to keep their stuff together in this world. You have no business being cruel to anybody. And I think, look, you could be 10 years old and have the internet and tell me what's wrong with the world, right? Why are we rewarding anybody for just saying what's broken in the world? I think you evaluate people based on what solutions they're offering, right? And if you're spending 80% of your time talking garbage and being negative, then you're the problem, right? You're the problem.
There. I'm not the problem.
You most
but
certainly are
I
not the
will lose my job if I don't keep us on time. There's a girl in the back going, Linda, cut. I said, you tried to cut the minister and Fred, Anyway, thank you so much, Minister. Thank you, Fred. Gros merci. And please stand up so you get a little, if you can stand up, get a little bit of energy, and welcome Siobhan to the mic. Merci beaucoup.